Examination of the ears. Assess the patient's ears. Inspect the palpate the ears. Ears can be variegated in size and shape, which should always line up with the eyes. They should be symmetrical, with no swelling, lesions, thickening, or pain. Now palpate the mastoid process behind the ears. This should not cause tenderness. Next, prepare to perform orthostatic exam. Since we don't have one, we'll just explain the procedure. Examine the patient's ear hole, the otoscope in your dominant hand between your thumb and fingers. Pull the pinna of the ear up and back to straighten the ear canal. Remember, you need to look in all directions to view the entire tympanic membrane of your drum. Then, inspect the external ear canal. You should not see redness, lesions, swelling, or exudate. Now examine the tympanic membrane or eardrum. It should reflect the otoscope slide and should appear shiny and gray with a white periphery. Its center should be concave with no preparation. Note, the malleus and the light reflex, especially you may see the incus. Finally, withdraw the speculum. If you see exudate on its change, the tip to prevent the cross contamination. Next, you will assess the patient's hearing by performing the voice, Weber and Grina test. For the voice test, gently include one of the patient's ear with your finger, then test the other ear as you stand 1 to 2 feet away from her. Ask him to close his eyes, gently wiggle your finger in the ear. While you whisper 2 syllables, would you be able to repeat the word whisper? One. Next, perform the Weber test to access the sound transmission through the skull bone. For this test, use tuning fork of 512 to 1024 Hz. Hold the tuning fork by the stem and then strike the tines on your palm. Place the stem of the vibrating or middle line patient's skull. He should hear the sound equally in both ears, meaning her conductive hearing is normal. Next, perform the RINA test, which can detect if the patient has conductive hearing loss. Strike the tuning fork again, place it on mastoid process, count the seconds until the patient says he can no longer hear. Can you still hear it, sir? This indicates air conduction or AC. Normally, air conduction is normally about twice as long bone conduction.